yourself honestly. Are you still doing old school rehabilitation techniques with your patients? Are you giving your patients exercise handouts that they're literally crumpling up the second they walk out your door? So many of your patients are presenting with debilitating postural distortion patterns. I want you to consider your patients who have lower cross syndrome right now for this example, okay? So realistically, this is going to be a large percentage of your practice base. Lower cross syndrome is associated with anterior pelvic tilt and often hyperlordosis of the lumbar spine. As the pelvis tilts anteriorly, the lumbar extensors and the hip flexors are going to be tight, and the abdominals, the gluteus maximus as well as the gluteus medius, are going to present with weakness. Tight hip flexors mean that the patient is flexor dominant and they desperately need to activate their posterior chain gluteal muscles for power while performing common movements such as sitting to standing. This is stuff they use every day. Now we all know that flexor dominant posture is a weak postural presentation interfering with the patient's ability to function optimally. One of the primary roles of the nervous system is to inhibit flexion. Flexion of the posture system is absolutely a neurologic lesion. It is a de-evolved position of human design. I know you have told your patients to do iliopsoas stretches. Now that's going to be a really good first step. However, for the majority of your patients, it's not enough because all of their habits promote flexor dominance. Whether they're sitting at a desk, driving in a car, or looking down at their cell phone, your patients are flexor dominant all day, every day. We need to take their postural rehabilitation one step further for meaningful rehabilitation results. This is not a crumple up the exercises the second I walk out the door type of rehabilitation. It's a revolutionary new device that has just hit the market. The answer is the J-Bit MedPro. The J-Bit was scientifically designed to strengthen the posterior chain musculature that holds your body upright, extended against gravity. Now you can see from the picture here, this is how you wear the J-Bit. Now when the J-Bit is on, my pelvis is held in neutral position to alleviate stress of the hip flexors anteriorly. As I walk, I am simultaneously activating the posterior chain musculature or the extensor muscles that are responsible for upright posture. You can buy a treadmill for your office and have your patients walk while in the office, or you can sell the J-Bit MedPros in your office and instruct your patients to utilize them and walk while at home daily. Now the effects are absolutely profound and they are instant. Start your patients off slowly, just walking for 5-minute intervals at the beginning. As they build postural fitness, have them increase their speed and overall time spent walking with the J-Bit. You can also have your patients do specific gluteal exercises such as squats and lunges with the J-Bit on. This will help them maintain proper posture while activating their musculature against resistance. You don't need a bunch of new equipment that takes up a bunch of time in your office to get superior correction results with lower cross syndrome. But you do need the J-Bit MedPro as a part of your rehabilitation strategy. The J-Bit is safe for patients of all levels. Patients feel immediate relief of pain and symptoms, and it definitely won't break your bank. To learn more about posture rehabilitation and how to implement effective strategies like this into your office, visit our website, theamericanpostureinstitute.com. And remember, docs, it's posture by design, not by circumstance.